Morning, John. Good morning, everyone. How are you? Already awake? Good. So, John already told you about his story and a bit about me. So my name is Julian Douwes. I come all the way from Germany, from the beautiful area of Bavaria. Actually, our countryside looks a lot like yours here. And our specialties in our hospital are chronic diseases, chronic infections, and we have a lot of patients like John and a lot of patients that are a lot worse. So basically, these diseases that we treat are invisible. The illnesses that no one sees, that no one recognizes, and just imagine, did you ever go to the doctor, you felt that you're off, that things are not going right, and you go there, he does the test, and he says everything is all right. You're okay, you're good, your tests are normal. It's just a part of aging. It's probably just stress, you're burnt out, or maybe it's just all in your head. So I'm here to tell you today that it's probably in your head because there is a bacteria in there. So this is your comeback whenever a doctor tells you now that it's all in your head and you're imagining it. You're not crazy. The main thing, what causes these symptoms, these problems, is that you're inflamed. That something in your body is off and your body is trying to fight it, but it's just too weak. And you're the one suffering it, and it's invisible. You may be bedridden all day, and then 3 days in a row you're better, and no one around you sees how bad you actually feel. So today I'm just going to take you on a small journey. We're talking about the symptoms behind these chronic infections. We're talking a bit about the science and then about the solutions. This morning I'll talk about the things that we provide for you, and this evening I'll have another slot that is just for what you can do at home. So a whole presentation just on that. So, did some of you already experience that? You wake up and you're actually more tired than you've been before going to bed. You have troubles concentrating. You basically have brain fog, like you can't clearly see your thoughts. Or you have just some random symptoms and you've been from doctor to a naturopath, to a chiropractic doctor, just out of desperation to find what's actually wrong with you. And most of the time, actually, if you look more detailed, we'll find an infection there. Or, you go to the doctor and they just tell you, oh yeah, probably it's just stress, it's all in your head, very sad thing. But the main problem behind this is that you have something we call silent inflammation. So there is like a little burning fire inside of you, and the most tests actually miss it. So if you don't specifically test for specific parts of the immune system, you won't be able to find it. And basically we have a immune response cascade. So we start out with a small trigger, so one underlying infection or an external toxin, and that aggravates your immune system. Then in the immune system, we have little pathways. I don't want to go into the medical part of this because even a lot of doctors won't understand it, but basically it will signal in your body, okay, we have an intruder here, go do something about it. And then with the pathway called NF-kappa B, we basically create a hailstorm that's going on inside of your body, and this is why you feel bad. And in the latest stage, we have an inflammation of little cells in your brain, which will then cause these cognitive symptoms. And by that point, when we talk about all sorts of chronic diseases, the initial trigger can already be gone. He's just there to start the whole thing, and then he walks away. With Lyme, unfortunately, it's not that way, but I'll go into that. They come to stay. So then later on, we have something in our body called the mitochondria. The mitochondria is what we refer to as the powerhouse of the cell. So this is where your energy comes from. This is where you break down sugar. This is where you basically get all your energy from. And if that is not working, and we have up to thousands in one cell, basically there is no energy produced. You will end up being fatigued. You will end up feeling tired all the time. You can sleep, you wake up, and you're still sleepy. And this is one of the most important things of modern diseases. It's mitochondrial dysfunction. But this is just a name for a syndrome or for a symptom complex. But basically, there are millions of underlying issues. And our job at our hospital is to figure that out, what the actual reason is. So, and then when everything is not working anymore, we can create something called free radicals. Maybe you've heard in some advertisements, that is antioxidative or this and that. Everything with that has to do with anti-aging, it's about something we call the reactive oxygen species, or ROS. And these are free radicals. They go around your body and start to attack each and every cell. And this is one of the main promoters of inflammation. So, and then we have another hormonal way to produce energy, which in the end will come back to the mitochondria. It's from the brain to the adrenals. And there's a stress hormone we call cortisol. And when your body is like, I always compare it to a motor, has to run in overdrive all the time, and it's on the highway with 180, 200, without ever braking, the motor will run hot and won't work anymore. So then we will have something that we call the adrenal fatigue. So your adrenals will not produce enough cortisol anymore. But before that, you have too much cortisol. So we can go into metabolic dysfunctions. So we can create insulin resistance up to diabetes type 2. We basically create chronic fatigue, chronic anxiety in people. And basically, the underlying reason for that can be a small little infection you had 5 years ago. So, and we have something that I call the 4I syndrome. It's basically one step after the other. We start with an infection. Then we learned after the infection we have the inflammation. This will lead eventually to a collapse of the immune system. And then in the end, because you're not functioning anymore, it will lead to a loss of identity. These people in the end lose themselves, lose how they've been before, and then eventually end up being just the disease. So with John, as he probably will tell you as well, it was also very similar. It was very close to this loss of identity, when you have to separate and can't do the things that you usually do, you can't perform anymore, you will lose yourself. So, and basically, in the final stage, we have an inflammation in the brain, and that has a massive cognitive impact. So, what does that look like? Daily functions, normal things that are easy for everyone, even brushing the teeth, can become super difficult. The dopamine system in the brain is basically not working anymore, and these people start to develop symptoms that ADHD or ADD people have. They can't concentrate. Simple tasks become very, very, very exhausting for them. And if we continue down the road, actually just walking up a set of stairs can put them into bed for the rest of the day. But in the moments when they actually do work or are capable of doing anything, no one from the outside actually sees how they feel on the inside. They're destroyed. They would wish to be able to stay in bed all day, but they're not depressed. It's not something that has an intrinsic cause. It's actually something that is in them, but it makes them stop and slow down. So one of the problems that we see is we have 40% less ATP. ATP is the thing that the mitochondria produce, and that is actually the currency of power in our body. We don't have batteries with voltages or watts. We actually deal everything with ATP. And that goes down, and we have 300% increase in these ROS, so reactive oxygen species. So a lot more potential damage to the cells. And NAD is the precursor of ATP, and this is like the wood that we store that in the end will be burned up. And if that goes down, you know, it's like a pool that we have in our body, and if that's depleted, none of the ATP can be produced anymore. And why do doctors miss it? Are they ignoring it, or why don't they believe you? Why don't they trust you when you tell them what actually is going on inside of you? The first thing is our test results are crap. Yeah, all our tests we have, they basically suck. I can't put it any other way. There are only a few labs. One of them, fortunately enough, is here. So we collaborated with Armin Labs already several years ago, and they are one of the 2 labs in the world that can diagnose chronic Lyme. And even if their test is negative, it doesn't mean you don't have Lyme. But I'll go into that why that is. So the doctors are presented with a disease they have no idea about, and then the test that they can find with their normal local laboratories is normal. So first of all, we can't blame them here. They don't know anything about it, and if the test is normal, they have to trust it. But what about the doctors that are Lyme specialists and then tell you you are actually negative? Because they should know, right? The problem is a lot of people went onto the train, jumped on the train because there is a lot of money in Lyme. And they also work with normal local labs, and if the test is negative again, what can they do? And we also have a very big problem in medical training gaps. You are not trained in medical school to attack these diseases. You're trained for everything that's acute. And if you have a broken bone, active pneumonia, if you have a stroke, heart attack, whatsoever, there's no better place to be than a hospital. Then a normal, even a local hospital will be able to get you through it most of the time. This is what we have guidelines for. This is what we train every single day. But when a huge system with multiple parts actually falls apart, this is when we fail. Not us, but us doctors in general. And I think one of the hugest problems is time. Doctors don't have the time to treat every single one of you how we would treat patients. If you come to me and basically come with your whole list of symptoms, I need at least an hour to take an in-depth look. And after this hour, I will know everything about you. I will know every country you've ever traveled to. I will know basically all sexual partners that you ever had in your life, because this is also important. If I want to know the actual reason why you're sick, in detailed talk to the patient, actually listening what he has to tell you is the most important thing. I don't just rely on laboratory results. I rely in the only person that can know what's going on with you, and that's you. Yeah? So if you have a 5-minute consultation, there's no chance, not even us who know a huge deal about this would be able to do it. So here we have some standard testing methods that clinics use, and I just want to go into the problem behind them. So the standard test for Lyme is something we call an ELISA test. Basically, we test for antibodies that your immune system has to create, and we're testing for them. What is the problem here? In the latest stages of Lyme, your immune system is already so suppressed and Lyme can actually hide from us and from the immune system, that there won't be any antibodies there to actually find. So the test is negative, but actually it just means your immune system is failing. Your immune system is not doing what it should do. So we have better alternatives. So we have the possibility to run an ELISpot, PCR, or what I prefer, a clinical diagnosis. So you'll get a big questionnaire, and on this questionnaire you'll have a lot of questions with all the symptoms that could come up in Lyme and how often they occur. And based on that, I can give you a probability of whether you have Lyme or not. Then we have a normal metabolic panel. What can't we find? We can't find mitochondrial dysfunction. So for this, we have to do something that we call ATP profiling or organic acids. If we look at the standard blood test that every doctor does, the CBC, we can't find basically any deviation in the normal immune system. We see if something is really messed up. If you're actively dying right now and have an active infection and this is what throws you over, of course we'll see it in there. But if we see it in there, things are really going downhill. And then one of the things, you come to a doctor and you already tell them, okay, I think I have a hormonal issue. And then you persuade your primary care physician to do a hormonal analysis. But then I have one little picture of the hormones in your day, in your week, in your month, but they're fluctuating during the day. So in the morning you have high cortisol, in the evening you have low cortisol. So if you're at 9 a.m. with the doctor and we take your blood, you will have a very, very different cortisol than you will have in the evening. So what we do is we have a 4-point test during the day where we test the hormones in the spit. So we see at 4 different points during the day, or if we go even deeper with female hormones, at 4 points per day, at 4 times in the cycle. Then we have an in-depth look. But you need to work with specialized labs that most of the time insurance doesn't pay, because the diseases that you have and that are treatable are not recognized. They don't exist. So I think a lot of people are here that can identify with some of what I'm saying, or maybe all, and you see, I believe you. I don't know if your doctor believes you, but I do, because I've seen it, and I also experienced it myself. So just to come back to functional testing, what we do, the main test for Lyme, that is the most important thing for me, is the Boriscano score. It's a clinical test. You can come to our booth in the middle of tent B. We can send you the questionnaire, and then in the end, I will give you a personal case review, or one of our doctors, I don't know how many people will come, but then one of our doctors will give you one in the next couple of days. Another thing that we do is something we call the VCS test, the visual contrast sensitivity test, because neurotoxins that are either released by Lyme or by mold, one of the first spots where they sit down is in the retina. And if they're in the retina, you have a problem seeing slight contrasts of gray. So there is a test where we can measure on a computer how high your toxic load in the retina is. If that is high, the probability of you actually suffering from a chronic infection is very, very high. Then one of my favorite lab tests in the world is the CD56-57. Because with the CD cells, these are something we call the natural killer cells in the body. This is our innate immune system. So the immune system you're born with. We divide in medicine between the innate and the acquired immune system. So when a baby is born, it was never exposed to influenza, for example. But it still has a defense mechanism, so if influenza comes into the body for the first time, we basically have police officers going around and searching everyone that comes by, and if it identifies, oh, this doesn't belong here, It will recognize it, it will take a mugshot, it will kill it. And then the mugshot is replicated throughout the body. This is what we call antibodies. And when the next time a similar intruder comes into the body, they're immediately going to be killed by specialized officers trained on the mugshot. But when you have a chronic infection, so back to the motor and overdrive, these cells will go down. You will have a depletion in your innate immune system because they're trying to compensate what your acquired immune system can't do anymore. And your acquired immune system should be able to get rid of it, but it can't. Lyme or Borrelia burgdorferi is way too intelligent for that. And another thing, super important, mycotoxin testing. The US has, I think about 80% of households have some mold issue. And when I have patients that come to me, mold is a big problem. But before I attack mold at all, you have to get rid of the active underlying infections, else you won't go or come anywhere. So, we diagnose too late. The people go to their doctor, the first time they already feel like, oh, yeah, actually I didn't feel good for the past 4 weeks. And the doctor says, it's just stress. And then down the road, they actually try to compensate, they're still going to work, they're coping. And then there's another infection, a little flu. Your nose is running for 3 days. And then, a week later, they're in bed. The chronic fatigue hits. Their life is over because that was the last drop, and that got the immune system to actually shut down and the bacteria take over. And to confirm again, if a doctor tells you it's in your head, that you have a comeback, yes, it is in your head. There is a bacteria there that gets you down, that brings you to your knees. So, as I told you, it's an invisible experience. The person feels it from the outside, the person looks fine. They might even look like they're faking. We have all sorts of patients, and every now and then you're like, oh my gosh, these symptoms, it can't be real. But then, as soon as you start to treat them, these symptoms will disappear, and it will go from mental symptoms into up to very, very physical symptoms. And I actually have to tell you, I had Lyme myself. So it was back in 2019, I actually gave a lecture at an Ivy League university. I was 20 at the time, 19. And I came back from there and I actually lectured to doctors about why antibiotics do not work in chronic Lyme, or even if the tests are positive, but the infection wasn't done or it didn't occur in the last 3 months. So I came back from that. I ran a routine lab, but out of curiosity, I also looked for my CD56, 57, and I also looked for Lyme, and I found Lyme. So obviously, for me, the rules about everything I lecture on stage do not apply. So I went down the route and I treated myself with antibiotics because I'm built different. And actually, I didn't feel bad at the time. I was super healthy. I was running 10Ks every day. I was totally fine. So I didn't feel any difference. And obviously, it didn't work. Now, about 6 months later, I had a simple flu. I had a running nose for 3 days. I was totally fine during the infection. But about a week later, my left arm started to get numb. Then, in the next week, my feet started to get numb. I was falling down the stairs. I developed mental problems. I called my fiancée several times and told her the same story several times a day. I couldn't work on patients anymore because besides not being able to recall their name, I also wasn't able to recall the conversation. If I have an hour, I think I would have been able to do the 5-minute medicine, but not the in-depth medicine that we do. And I deteriorated in a matter of 3 months to a bedridden, suicidal thing. Because with the disease, it was like it flipped a switch. You're depressed because I can't even say it any other way. It fucks up your hormonal system, it fucks up your dopamine center and your serotonin center. You can't be happy with that disease. In best of cases, you don't feel anything, so you feel indifference to everything. But in most of the cases, it leads up to depression. And I can tell you, if I would go into a lot of mental institutes in this country, and I just test them and treat them, I could clear out about 60% of them. So here I was, and we are experts on Lyme. My father did this for 28 years, 27 years at that point. And we always see it when it's too late. We never observed it firsthand. So I thought at that point, oh no, I'm actually just going crazy. I have to go to the mental hospital. This is not normal. And my father was also doubting it because at this point, I was in the latest stage of Lyme. My Lyme test was negative, even with Armin labs. So my immune system was so messed up that we couldn't find anything anymore. And this whole experience changed me. I will go into the therapy that I did because eventually I went through the therapy in our own house that I try to avoid because the people that treat me are the ones that know me my whole life. And when you're the superior person, you don't want to see your employees seeing you naked and putting a catheter in you. So it made me very human. It made me switch my perspective on this disease. I know very deeply what these patients feel. I saw the invisibility. I witnessed it firsthand because from the outside I was still looking fine. From the inside, I had so much pain. I didn't know how I got through the day. I just didn't know. So there is a science behind this, what we call stealth infections. So they're basically hidden in your body. And we have a very, very complex interplay of several systems in your body. And the only thing, or the main thing that we have to do is we have to target all of them at once. And let's go to Borrelia. Borrelia is a master of disguise. So Borrelia usually looks a bit like a corkscrew-shaped bacteria, like we see in figure A. But it can hide. It can actually put the antigen representing outer shell to the inside. And then we have something we call the persister forms, cystic forms, L forms. There are a lot of names for it that we see in I and J. And when they're in this stage, they're not reproducing anymore. At this stage, they're in your body producing the toxins, making you sick, but your immune system can't detect it, and you're basically, it's hopeless. And they produce biofilms. So this is what we see, for example, in figure F, this little thick structure around it. You can compare it to duct tape. They wrap themselves in bubble wrap and duct tape, so they're protected. They can protect themselves from antibiotics. They can protect themselves from our immune system. And you can't even be mad at them because they don't want to be inside of us. We're the wrong host. They make us sick because we are the wrong host. They're just trying to survive. We have a wrong pH level and we have a wrong temperature for them. They don't feel happy inside of us, so they make us very unhappy. And then we have co-infections. Co-infections are other infections like Babesia, Bartonella, Rickettsia, Ehrlichia, parvovirus. So there's a big list of them. But why are they called co-infections? They don't usually exist on their own. So there is an underlying infection that already suppressed the immune system so much that they can actually spread inside of your body. Yeah. And what happens eventually, because of this immune cascade that we talked earlier, where everything starts to flare up and we have the silent inflammation, this actually weakens the blood-brain barrier. Our brain is usually totally protected from everything that comes from the outside. And we also don't have an immune system up there. So if we have an infection in the brain, this is why that kills people. Let's see, for example, FSME, or if someone has a meningitis. This is still, to this date, a very deadly disease because your body can't fight it himself. So once they're in the brain, they're having a party up there. And you're the one who suffers. And let's remember, we have the mitochondrial failure. So we have the healthy levels as a reference, and then we have a decrease in NAD levels, we have a decrease in ATP production, we have more free radicals, and the membrane potential. So our cells operate with electricity. Yeah? So whenever a channel opens to actually get something in, like sugar or whatever, we need a change in currents. But the whole membrane potential decreases, so we actually need more energy to get something into the cell, but we have less energy. That is a recipe for disaster, and this is why people feel bad. So, same mechanism, the disease enters, the pathogens try to evade the immune system, they're able to hide, they're super intelligent, although they are bacteria. They go wherever they want to go, especially where there is no blood flow, for example, in the joints or in the brain where there is no immune system. And then they start to produce biofilms. They start to wrap themselves and they will go into this persister form. And then they lay dormant. Lyme disease can actually stay dormant for up to 15 years. So after you have the infection, it can actually stay like that for 15 years without you actually getting sick. And then 12 years after a tick bite, you get a little flu, and that will bring you over the edge, and we call that opportunistic reinfection. So then the dormant bacteria will start to reproduce, and you will actually get sick because your immune system was basically, the attention of the immune system was deviated onto another thing. So let's go to the therapies what we have at St. George. So it was 1996, and we are actually an oncology center. So we are a world-renowned cancer hospital. We treat everyone, even Hollywood stars, they come to us. My father was one of the pioneers if it comes to oncology research. So he had a breast cancer patient that came to him and said, Dr. Douwes, actually I'm not suffering from my metastasized breast cancer. I actually suffer of Lyme disease. So my father was like, okay, then just take 2 weeks of antibiotics and then you're done with it. But she said, I tried everything for years and nothing works, but I have so severe brain fog. And then my father was already like, oh yeah, that's probably because of the chemo you received. There's something like chemo brain. But one of the main treatments we had in our cancer therapy is whole body hyperthermia. So the fever response that we create in the body actually improves the function or the efficacy of the chemotherapy, and your immune system attacks cancer cells better. So that was the thing, and we had all the research, or all the underlying research was on stage 4 cancer patients that we put into the hyperthermia unit and then gave the chemotherapy in the hyperthermia unit. So this patient actually went to the treatment, received her chemotherapy in there, and the next day on grand rounds, my father came in and she was like, Dr. Douwes, what did you do? You put the sun back in my brain. I can finally think again, the first time in 10 years. And he was like, oh, that's nice. Probably you got rid of a lot of toxins and this and that. So he didn't believe there was Lyme. 6 months later, he had another patient, also from the US, an ovarian cancer patient. Similar story. So basically, he treated her the same way, and also the Lyme symptoms were gone. So this is when he started to go down that road, and he did all the research behind it. This is what a hyperthermia unit looks like. We have infrared in there, and you're in an ICU unit, so next to you there is an ICU nurse, and next to the 4 beds we have a doctor. We will put you into a little sleep. You maybe know it from colonoscopies. It's a sedation, so you're out. You won't remember a single thing, but you're breathing on your own. It's not general anesthesia. And then we heat your body up to 106.8, 106.9 degrees Fahrenheit, and once we reach that stage, and this is what has been proven in several labs, in petri dishes, in live animals, this will kill off the spirochetes. So Borrelia dies mechanically in there. And the effects of this treatment will be amplified with several antibiotics that we combine in there. And this is why we call the treatment the antibiotic augmented thermoeradication. So, $5 word, but this is actually the theory behind it. We create an artificial fever, and I can go into the underlying thing. Back in 1918, there was a professor, Professor Julian Douwes, who received the Nobel Prize for something we call the malariotherapy. At that time, we didn't have antibiotics, but people came back from war with syphilis. So syphilis was untreatable. Syphilis comes from the same, it's the same type of bacteria as Lyme is, and the people got the same symptoms. So what he did was he wanted to create fever in these people, and he took the blood from malaria-infected patients and injected them with them. So he infected them with malaria, and what happens when you have malaria? You get severe fever spikes, and all of a sudden these patients were cured. And that is the heat reaction behind this. The bacteria dies off with heat. And that is the main principle behind this. It was proven, we worked together with Professor Rising at the University of Graz in Austria, and he demonstrated that all strains of Borrelia die off at 106.8 degrees Fahrenheit. And that's fortunate, because we can't go a lot higher than that without actually affecting your body. So that is the exact temperature your body is able to tolerate. Good. Maybe if you guys looked into the therapy or therapies in general, you've seen that there are clinics in Mexico that also offer hyperthermia treatment for Lyme. All the research behind this comes from us. So it was the total serendipity that my father was researching that. And if it would work with moderate hyperthermia, believe us, we would do it. It's a lot easier to do moderate hyperthermia than extreme whole body hyperthermia. You wouldn't need ICU beds, you wouldn't need a lot of personnel for that. And the thing is, if you go into moderate hyperthermia, I promise you, you will feel better for about 3 months. But then it comes back, and it comes back much worse, equipped for everything, because they will have a biofilm protection like they never had before. And you have a heat shock response. That is good. The heat shock response is what we want, but we need the extreme heat shock response. And the immune system is not as activated as in the high temperature, but the main problem behind it is you need to be at the 106.8 to actually effectively kill it. So what do we do for the co-infections? For the co-infections, we use UV light. But how do we get UV light into the blood? We use a glass fiber catheter. We put the glass fiber catheter into your vein. We hit the vein with UV light, but in the past we've seen that is not enough, because from that little part we can't reach all the blood, so we will give you riboflavin. It's vitamin B2. We will give that up front, and then you will have like a black light party in your blood From this one little catheter, your whole blood on the inside will illuminate, and we can kill it. You know, UV light kills pathogens. It's been proven several times. So with this, we get down all the chronic viral activations. We will get down Babesia bartonella, but we can't reach through the blood-brain barrier, and this is why we can't treat Lyme just with this. Then we have the HELP apheresis. The HELP stands for heparin-induced extracorporeal LDL plasmapheresis, also a $5 word. Here we're filtering out all the waste that we created in the hyperthermia, all the died-off bacteria. We get out the inflammatory proteins, so after 1 to 2 treatments, your inflammation will be down by 90–95%, so you will feel a lot better. And basically, we will totally reset your system. And one of the good things is, this is the treatment. If you have post-COVID and you have spike protein in your body, this treatment is what will get out and absorb all the spike proteins. If you've had Lyme for a long time, you also have GI issues. So your microbiome, so the diversity of the bacteria, is destroyed. For that, we do something we call a microbiome transfer. We did fecal matter transplants in the past, but the problem is you can have a donor rejection. So we work together with 2 universities to create the best living bacteria cocktail without the possibility of rejecting it. And this is what you will receive on if you need a microbiome transfer. And also, we will start to treat your mitochondria. So after we got rid of the infection, we will start repairing everything bit by bit. So you get several IVs. We have altitude training, hyperbaric oxygen treatments, intermittent hypoxic training, everything to restore you to how you've been before, or actually probably better. We will do the hormone balancing. We will do a neuroregeneration. We will detoxify everything out of you. And you will be set on anti-inflammatory nutrition. And that will lead to a total reset of yourself. There are also several supplements that we use. Most importantly, this is a very good supplement that will also be sold over in Tent B. Optimune contains over 40 minerals and herbs. But just come to me, I'll explain everything in detail. I'm running out of time here. Green tea extract, cat's claw, electrolytes, very, very important, especially today. It's very warm and humid. And maybe you can go over there, buy some, and drink some to get through the day. So just come over to the booth. We will have lab test kits over there, so we can actually test you for Lyme while you're here. And we have some supplements over here. The company that we have created will actually come to the US mid of this year. Then all the protocols will be available here. And yeah. Tonight, I'm going to talk about everything you can do at home. I will go in detail to and talk about the supplements as well, and what you can do in your home to actually target all these things I talked about right now. Thank you very much.